So acute appendicitis is a very common surgical emergency. So appendix is a small tube-like organ hanging from the first part of the large intestine, that is a cecum. So infection of the appendix is called as appendicitis. So patients will have pain starting in the umbilicus, then moving to the right side of the lower abdomen. Sometimes they have vomiting, fever, and loss of appetite. Appendicitis is best diagnosed by clinical examination by the surgeon. Patients will be having tenderness in the right lower abdomen, and an ultrasound scan will pick up the diagnosis of appendicitis. Sometimes when there is doubt of appendicitis, a CT scan is very helpful, especially when the appendix is located behind the colon or the patient is very obese. The best treatment for appendicitis is laparoscopic appendicectomy, that is removal of the appendix. So why do we suggest appendicectomy surgery as the first option is, if left untreated, appendicitis can cause many complications, like it can become gangrenous, that it may lose the blood supply and become black and perforate. Second thing is, when the infection is very severe, the appendix perforates, it breaks open, all the contamination happens in the abdomen, the patient can become very sick. Sometimes, in some cases, the appendix infection will lead to something called as an appendicular abscess. So it forms a pus collection inside the abdomen and the patient can become very sick. Sometimes, as a natural history of the disease, the appendix will form a mass, that it gets adherent to all the structures around and becomes a mass. So the best treatment is laparoscopic appendicectomy. The rationale of doing an appendectomy is to prevent the complications. There are some situations when the appendicitis is very mild, we can give antibiotics and treat. But more than 50 to 60% of patients who are treated with antibiotics will get recurrent appendicitis. Then they have to go for surgery again. So in our practice, the best treatment for appendicitis is laparoscopic appendicectomy. The surgery is very simple if you come early. Laparoscopic surgery has a very rapid recovery. You have to stay in hospital for a day, the next day you get discharged. Suppose you come with complications like an appendicular abscess or a perforation or a gangrene of appendicitis, then the hospital course, the treatment, the surgery, all these things are getting prolonged because of the complications. You may have to stay in the ICU, you may need very high-end antibiotics, and the recovery is prolonged. Sometimes the surgery may not be possible laparoscopic, and you may have to undergo open surgery also. So the simplest treatment and the best treatment for appendicitis is laparoscopic appendicectomy. My name is Dr. Dattaram. I'm a consultant surgical gastroenterologist and a laparoscopic surgeon practicing in Hyderabad. If you like the content, please like and subscribe for interesting updates. Thank you so much.